I broadcasted. It's still not showing up.
Susan, you can promote her now. Okay, yeah, you're good to go. Yeah, Susan, she's in.
I do. I don't have an opinion. I don't. Susan, I see you. Bruno, I see you.
Just so you guys know, we are broadcasting right now.
He said we are on broadcast. Okay. Oh my gosh. Okay.
Hello, and welcome to everybody who's joining us. It's so great to see everybody. Let me see if I can see who's here. Oh, we got Chris. Hi, Chris and Dawn and Isaac. Welcome. I'm just going to test something. Nope, doesn't work. Okay, yes. Okay. Just checking my slides, making sure they work. Sorry, just pointing to somebody in my house. So my hand frantically waving there. Who joined us? Karen. Hello, welcome. Just frantically telling somebody in my house they have to leave the room. And another Karen. We have a lot of Karens in this program tonight. I know some people have put questions into the question section on the Hoover app, and we will get to those. And then other people can also add questions to the Q&A portion on the bottom of the screen. Oh, actually, you can. I'm sorry. You can actually continue to add questions into the app on the phone. Hi, Pam. Welcome. You can continue to add questions to the app on the Hoover app. After the program, we will try and cover all of the questions. And it's 7:24. We're going to start officially in 6 minutes. And Karen, when we start, just put your video off, and I will put Karen Mountain Johnson, and I will put my video off so everyone can see the full screen. We just had some new people join us. Welcome. Annette and Jan and Jennifer. Oh, hi, Abby. There's Abby. Hope everybody's been going to other programs as part of the summit and has enjoyed listening to them and being a part of them. Tonight's the first one that I'm moderating. So if there are any technical issues, please excuse them. I have several more to do, and I'm sure I will get those technical issues solved along the way. Okay, 3 more minutes, and we'll begin the program. Hi, Anne. Who else joined us? Anne and Inez, Bridget, many people. Welcome, everybody. Great to see everybody tonight. Or this afternoon, depending on what time zone you're in. I want to welcome all the new people who just joined us. Thank you for coming tonight. Or as I said, this afternoon. I realize there are people from all over the country, and we have people from all over the world attending this summit this week, this next couple of weeks. So it's very exciting for everybody. Okay, it's 7:30, and I want to welcome everybody. My name is Susan Leshin, and I am the Senior Program Director Senior Director for Program, Patient, and Volunteer Services for the Marfan Foundation, and I'm very happy to see you tonight. We are thrilled to have you participate in the International E3 Summit, educating, empowering, and enriching our community. This is brought to you by the Marfan Foundation and its divisions, the loey-dietz Syndrome Foundation and the VEDS movement, and our partners in Europe at VESERN. We are very grateful to our presenting sponsors, Brigham and Women's Hospital, and the American Communication and Construction. Before we start the presentation, I want you to let you know that the International E3 Summit is a forum to provide an open discussion of issues related to genetic, aortic, and vascular conditions. Opinions stated in each of the talks are those of the speakers and not necessarily those of the Marfan Foundation or of VESERN. Tonight, we are very fortunate to have with us Karen Mountain Johnson, who is a fantastic therapist, coming to us all the way from Twin Cities in Minnesota. Following the presentation, there'll be plenty of time for questions. Please put your questions into the Hoover app in the question and answer section. We will do our best to answer as many questions as we can tonight. If you do not get your questions answered, please feel free to follow up with me or to send them to marfan.org/E3ask. And with that, we are going to start our video tonight. And I am going to stop my camera. And Karen, can you please stop your camera? Okay.
So today we're talking about building resilience and some practical ways that we can promote a healthy body, mind, and spirit. So we're going to first start by talking about resilience. It's real big right now in pop psychology. So we're going to talk a little bit about what we mean by resilience today, what it is, and we're also going to talk a little bit about what it isn't. We're going to go over why resilience matters, and a few specific ways that we can work on building resilience through body, mind, spirit. We'll take a few minutes at the end to come up with some very pragmatic ways to nurture resilience in children. This is going to be geared towards parents and caretakers, and I'll identify a few specific considerations for those that have connective tissue disorders, and we can certainly talk more about that in the Q&A portion. Okay. So first, let's talk a little bit about what is resilience. And again, there's a lot of different definitions for resilience, but here we're really looking at adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. It's coping and rebounding from adversity and growing through the experience. So here we're thinking about thriving versus surviving. A lot of times folks will get this idea that resilience is supposed to be not being impacted negatively by those things that happen, and that's really not what we're going for here. We're looking at the ability to have those negative things happen and come back from them in a positive way. So resilience is not going to protect you from suffering It's not going to protect you from experiencing those negative emotions, those negative situations. It's also not a passive personality trait that somebody either does or does not possess. Sometimes folks will say, oh, you're so resilient, as though that was a gift that you were born with. And it's not something that is just granted upon you. It's something that most of us need to work at. And it's not extraordinary. It's not something that is limited to a unique group of people who happen to be emotionally spectacular. It's something within all of us, and we really do have the opportunity to figure out how resilience works within us and how to nurture and grow that within ourselves. As I was preparing for this presentation, I found a quote that really stood out to me, that resilience is very different from being numb. Resilience means that you experience, you feel, you fail, you hurt, and you fall, but you keep going. And that really captures my conceptualization of resilience, that it's really about experiencing everything that life throws at us and continuing to move forward in a positive way in spite of it. Okay. So why is resilience important? I think a lot of this is pretty intuitive. There are physical health benefits, there are emotional health benefits. The physical health benefits are looking at how can we live longer. And of course, folks with Marfan's, loey-dietz, and VEDS, that's something that's often in the forefront of our minds, this notion that we're going to have a shortened longevity. And from a very pragmatic point of view, resilience can help that. There is quite a bit of research that supports that longevity is benefited by having resilience. Improvements in blood pressure, increases in immunity, decreases in insomnia, heartburn, indigestion, heart disease. All of these physical measurements of health and wellness are statistically significant in their improvements when people are practicing resilient skills on a regular basis. The flip side to this is the emotional health benefits of practicing self-care and resilience. And this is all about living better, enjoying our lives more. So when we're practicing good resilience, we have improvements in life satisfaction, mood improvements, reduction in anxiety. We see improvements in our relationships, focus, motivation, and we're better able to hold on to a sense of purpose and goals for the future, which again, that's really this kind of fundamental component of being human and of living with a chronic and life-threatening disease. So let's get down to the nitty-gritty here. How do we build resilience? I've talked about resilience being a muscle that we can build. How can we work on that? So we're splitting this into body, mind, and spirit, and we'll start by talking about ways that we can improve this with our bodies. Ways that we can improve our resilience with our body: move your body. Find ways that are safe to get your body moving to improve blood flow. Cardiovascular activity will release endorphins. It acts as an analgesic, so you're going to have some pain management benefits from that. It also stimulates all of those feel-good neurotransmitters: dopamine, serotonin, norepinephrine. So as much as you are able to safely do, try to fit in some regular cardiovascular activity into your day. And of course, with all of these, work with your medical team before starting anything new. Work with your medical team about what's safe for you to do, but within those limits, find some ways to do some cardio on a pretty regular basis. Strength training, there's been some preliminary research that suggests that in addition to just feeling stronger and being more capable in your life, that improved strength actually results in improvements in cognitive function and memory. And stretching, even gentle stretching, is going to increase blood flow, stimulate those neurotransmitters again, boost your mood, and support mental clarity. So even though we're focusing here on moving your body in ways that you can help your body to feel healthier and more robust, there are also emotional and cognitive benefits that manifest from doing these activities. You also want to be mindful about fueling your body in a healthful way. So nutrition, you're looking at whole foods, natural foods, things that come from the earth as much as possible, those things that are going to help your digestive system operate smoothly, as well as help your body just feel clean and energized. Hydration will have a similar effect, making sure that you're getting those 8 glasses of water a day minimum, and minimizing or eliminating all of those mood-altering substances that might feel good in the moment, but end up having some pretty significant impacts either the next day or down the line. So minimizing caffeine, alcohol, even processed foods are known to really bog down the way your system functions. And last, making sure that you rest your body appropriately. The most obvious way that folks do this is to prioritize sleep, which is a wonderful thing to do. Make sure that sleep is part of your health plan. We will schedule in doctor's appointments. We'll schedule in our exercise routines. Oftentimes, sleep is the thing to go. And it's a pretty good idea not to do that, because sleep is going to provide the foundation for everything else that you're doing. Moderating your energy expenditure. This is talking about pacing. So pacing yourself throughout the day. If you struggle with fatigue and low energy as a result of your condition, being mindful of that and adjusting your day that in a way that allows you to do things that you need to do throughout the day while also giving yourself time to rest. And the last note on resting your body is to consider some meditation practices. And this can involve spiritual meditation. It can also be basic mindfulness meditation, where you're really focusing on deep breathing, muscle relaxation, and just calm awareness of your surroundings. Again, with meditation, what we're finding through research is, yes, it provides those immediate benefits to your mood and focus and those kinds of things, but there's also a significantly growing body of research that tells us that meditation has whole body benefits to your cardiovascular system and your overall health and wellness. All right, so next we're going to look at how do we build resilience from a cognitive perspective. And it's been said, between stimulus and response is a space. And in that space is our power to choose our response. In that space lies our growth and our freedom. And now, as a mental health therapist, this is probably where I spend most of my time. This is where I do most of my work, helping folks to find ways to choose deliberately how to use that space in a way that is not just helpful, but is also accurate and rewarding. So there's a few specific ways that we work on this in a therapy practice, and hopefully you will find helpful as well. So let's move to the next slide. Okay. So the space in between the stimulus and response, what we're able to do with it is all about perspective. You'll notice on the right-hand side, I have an image, and there are a number of different ways that folks might see So today we're talking about building resilience and mindful of that and adjusting your day that in a way that allows you between the stimulus and response. What we're able to do with it is all about perspective. You'll notice on the right-hand side, I have an image, and there are a number of different ways that folks might see the image that I have. Some folks might see a butterfly. Some folks might see the profile of a face. Some folks might see a chalice or a vase. And what you see has everything to do with what you're noticing and what you are ignoring. And there's all kinds of artistic theory behind this, and I won't go into that. But the point that I'm wanting to make with it is that there is, within the spectrum of what is actually there, from a very reality-based perspective, we have some space to make choices about which part of a situation we're going to choose to focus on and which parts of a situation are we going to choose to let shift back into the background. So this isn't about optimism exactly. It's not about pessimism. It's really more about helpful and adaptive realism. Take what you have in front of you, but make it as helpful and rewarding as possible. And just a real quick note about the ways that we do this, especially with building cognitive resilience, there's a benefit to having a great deal of persistence. A lot of these concepts seem pretty intuitive, and they are. They're much more difficult to put into practice on a regular basis. And it's that kind of persistence to routinely and regularly make those shifts to more adaptive and helpful ways of thinking about things that are going to give you the most long-lasting benefit. Within neuroscience, there's been quite a bit of consideration of neuroplasticity, and neuroplasticity is looking at how we are able to actually rewire and readjust how our brains make connections in those really rapid fire moments between stimulus and response. And what we're finding is that through persistent efforts, we're actually able to make those kinds of changes so that we are more naturally inclined towards optimistic perspectives versus pessimistic perspectives when we're able to practice this on a regular basis. So how do we do this? Easier said than done. The starting point for most of this is in radical acceptance. In my practice, most often I get a pushback about acceptance, meaning that means we're supposed to just tolerate and be happy about the things that are happening. And radical acceptance is not about any of that. Radical acceptance is about acknowledging the reality of what's in front of you and using that as your starting point. So that can mean acknowledging and embracing your imperfections. It might mean acknowledging the limitations that a diagnosis has placed or that a significant medical event has maybe placed on your life. You might not like it, and in fact, you probably won't and shouldn't. But without being able to start from a place of acknowledging that this is where you're at, it becomes very difficult to move forward in a way that is nurturing and healthy. That also leads into accepting change. Accepting does not mean that we like the changes that these diagnoses will make in our lives, but it does mean acknowledging that that is what it is. We tend to spend a profound amount of energy cognitively and intellectually fighting against the things that we don't like in our lives. And although that's completely understandable and normal, it's wasted energy. Fighting against the limitations that you have, fighting against the unfairness of having the diagnosis, fighting against this desire for things to be different is simply not helpful. And it uses your resources in ways that really promote an overall dissatisfaction in life rather than a satisfaction. So here we're asking you to make a conscious choice to look for and see the positive aspects of your situation. So if you saw the profile of two faces in that picture, it might mean making a conscious choice to see the butterfly. They're both there. They're both valid. They are both actual things that are happening in your life. If you're able to acknowledge and see the positive things, you will experience more joy and you will experience more resilience. And that's going to be better for you and everybody in your life. And this moves into this notion or this idea of having an intentional focus. Being aware of what is it that you want to devote your intellectual and cognitive energy towards. So having a hopeful outlook is choosing deliberately to look at the aspects of your situation that are positive, that do have hope. It does not mean that you're naively assuming that things are going to be fine and the sun will come out tomorrow and all of those cliches, but it means making a choice to bring attention to the parts that are okay and the parts that are hopeful. It can also be very helpful to have an eye towards altruism and helping others. I've seen that tremendously in the short time that I've been a part of this community, that when folks are able to shift their attention away from the things that are troubling them and towards others in the community that might benefit from their knowledge and their experience, it's great for the folks that are getting that attention and that support, but it's also good for the person delivering it. Because when we're tuned in and keyed into ways that we can be helpful to others, it helps us get ourselves in a better headspace. All right. Now the last piece, this is a little bit more amorphous, and this is trying to build resilience in our spirit. There's an infinite number of ways we can do this. The most obvious is to find opportunities to laugh and play. I've had the privilege of meeting a few people in this community, and I found that I think that's a pretty common theme for most of us, that if we're not able to find a way to laugh at what's going on, then it's a real struggle. And so most of us find ways to laugh and enjoy things in our daily lives, but really make that a priority. Build connections with other people. Again, this is something that I found the community to be really helpful at. Folks with new diagnosis, folks that are struggling, to help us to find each other and help us to find individuals that will understand what we're going through. And the last area here is to find your purpose. Find a purpose that gives you structure and movement towards the future. This can be spirituality. This can be your family. This can be making progress towards and setting your own personal goals. But regardless of where you're at in your journey of this diagnosis and this journey of your health condition, knowing that it's only a part of yourself, that there is more to you, that there is more to your life, is tremendously valuable. Okay. So we'll shift gears a little bit here and talk about how do we nurture resilience in children. Helen Keller has been known to say, although the world is full of suffering, it is also full of the overcoming of it. And as the parent of two small boys, two beautiful little humans who unfortunately have this condition as well, I think about that as being one of my primary roles, and my primary goal with my kiddos is to think about how can I help them be champions in their own lives? How can I help them live with this condition and overcome it in amazing and wonderful ways? So let's talk a little bit about how we can do that with kids. When I think about how we can break down resilience in kids and how we can nurture it, there are three main categories: I have, I am, and I can. Those are the things that we want to support and build in our kids. So we want kids to know, not just to have them, but we want kids to know that they have external resources that support their own resilience. We want kids to know that they have trusting relationships, structures and rules at home, even though they might not want those structures and rules at home. I promise they're helpful. We want kids to know that they have role models, that they're encouraged to be independent, and that they have access to basic needs. So as caregivers, our goals or our caregiving opportunities are ways that we help our kids learn these things, help our kids to develop these things. So we can do that by demonstrating consistency and reliability, which goes along with establishing and maintaining clear expectations. I know it can be tempting at times to have a greater degree of sympathy and empathy for kids that are dealing with chronic illnesses, and that's appropriate, obviously. But what is also appropriate is for them to know where the limits are, and that you are going to be a rock despite what happens in their external world, that they're going to have that stable landing ground regardless of what's happening. If you're able to surround yourself with family and other emotionally healthy people. Again, that gives them different role models, a lot of different ways that people might practice resilience. They're able to see that and know that there are people around them that support them. And allowing them to try different things, to struggle, to fail, to learn from it, and to try again. I think this is really hard with VEDS kids in particular, which is what my kids have, recognizing that they need to learn their own limits, even if that means that they fall and scuff their knee or fall and get a big bruise. That there's a real fine line between doing what you can do to keep your kids safe while also giving them opportunities to learn and grow. And as a parent, as a caregiver, being able to let your kids develop their own capacities is immensely helpful. And of course, as much as you're able to provide the basic needs, if you're not able to provide basic needs, seek that support, and your kids will see that as well. All right. We also want kids to have an internal sense of their personal strengths. So these are I am statements. I am lovable and likable. I am empathic, proud of myself, autonomous and responsible, filled with hope and trust. And these are characteristics that everybody has. These are characteristics that your kids are born with. Our job as caregivers and caregiver opportunities are really about allowing your kids to see that. So that might take the form of reflecting what you see in your kid, taking joy in who your child is. They're able to see your joy, and that gets reflected back to them. Accurately observing your child's character strengths. So allowing them to see that you see them. Having that reflection back onto them helps to reinforce that those things are in fact true about themselves. The best that you're able to model your own self-esteem. And this doesn't mean that everything that goes on in your life you think is great and wonderful, but demonstrating that you do care about yourself, that you are valuable, and that you are capable regardless of what challenges and limitations you might have. And then lastly, taking opportunities to observe and note those times that kids have been successful in their independence. And this doesn't mean, a pat on the back or a trophy, so to speak, but really letting them know that you saw that. Wow, you were really struggling with that and you figured it out. This was really hard for you and you kept working at it. All of those kinds of reflections help them to see the internal characteristics that they already possess that help them to be more resilient in the tasks that they are approaching. All right, and the last one, I'm gonna have you go back for a moment. The last one is looking at I can statements, and these are social and interpersonal skills. So we want children and young people to know that they can communicate and advocate for themselves. That's something that all of our kids are going to need to know. We want them to be able to problem solve, manage their feelings and impulses, recognize their own and others' feelings, and know how to seek out other trusting relationships and support. So the opportunities that we see here are responding to those communication efforts and trying to understand them. You're not going to understand your kids 100% of the time, but showing them that you're wanting to and showing them that you're trying demonstrates to them both that you want to hear them, that they deserve to be heard. It also helps to model how to communicate when there are communication challenges. You want to give kids opportunities to solve problems independently, again, with age-appropriate support, but finding those opportunities for kids to stretch and grow even when it's difficult. Modeling your own emotion regulation, teaching emotion regulation when you're able to, and then reinforcing your children's observations of themselves and others. I did put a note on here on the bottom about observing your children's skill in self-advocacy, and that goes along with communication and problem solving, but I think merits its own comment. Having kids that are growing up with a serious medical condition one of the most important skills they're ever going to have is the ability to learn about and self-advocate. And finding any opportunity to nurture that is, again, immensely helpful in setting your kids up to be successful in all areas of their lives, but especially in terms of taking care of themselves physically and medically within the medical community. All right. So some unique considerations about folks with connective tissue disorders. I don't want to spend a lot of time on this because I think this is probably a conversation that would be better served in the Q&A, but I did note a few specific things that are particularly difficult for people with connective tissue disorders as it pertains to resilience. And the first one that came to my mind are the physical limitations. There's a lot of different ways that people without these challenges might use resilience physically and exercise and strength to really help boost their emotional and cognitive health in ways that folks with connective tissue disorders might not have the same access to, which would bring us to the practice of acceptance and working within the limitations that we have, but acknowledging that that is particularly difficult. Of course, we all have this chronic uncertainty and a chronic risk of serious and life-threatening complications. The burden of that uncertainty is profound and really cannot be overstated, which, although it's a unique consideration and a challenge, it is also the very reason that developing resilience is so important, both amongst adults and with kids that have connective tissue disorders, because that uncertainty and that chronic risk is a reality and something that we all need to find a way to live with, for better, for worse. We've also got a great deal of experiences of grief and loss. We can see this within family units and within the community. We're all exposed to people that have more serious life-threatening complications than the average public would have. And it's important, again, to acknowledge the burden and the challenge that goes along with that. We've got some limited knowledge and recognition within the medical community. That's growing, and I hope that continues to grow, but I am aware that that also provides a certain burden to many of us, knowing that we have to become the experts in our own medical condition, and that there's some challenges in accessing professionals that really are knowledgeable, and developing a team of them is a challenge. And the general public, friends and family, oftentimes have a difficult time understanding what it's really like to live with one of these conditions. And certainly the general public has a difficult time understanding what it's like to live with these conditions, and having a support network of people who really get it is so important, but it doesn't always happen readily in our day-to-day lives. And so needing to be creative about how we address those needs and how we live with some of those challenges. All right, I've got some various acknowledgements and resources here at the end. These two resources are geared specifically towards parents. There are a lot of age-specific recommendations for parents in both of these links. So if you're looking for really pragmatic, kind of nitty-gritty things that you can do with your kids and pay attention to with your kids, regardless of kind of their age group and their place in development, I really encourage you to check those out. Edith Grotberg's in particular in the International Resilience Project, she does a phenomenal job breaking down developmentally appropriate things to emphasize in the development of resilience. And then at the tail end here, I've got a number of different resources that outline some of the main concepts that I've talked about, but a number of additional practical ways that you might try some different coping skills or different interventions that you might try in your own life to address some of these areas. All right, so Maya Angelou said, "I can be changed by what happens to me, but I refuse to be reduced by it." And that is really what I'm getting at here, that resilience is all about living with a condition and not being defined by it, continuing to grow and improve yourself in spite of the different challenges that we're facing.
Thank you so much, Karen. That was absolutely wonderful. I hope that everybody really enjoyed it. Karen, okay, your camera is on and speaker's view. Okay, so we're now going to have our question and answers. There are several questions that are in the app that I'm going to address first. And if you have any other questions, please submit them to the app and I will present them to Karen. Karen, the first question here says, anxiety is a real issue for many with chronic conditions. How can we stay on top of our health without elevating anxiety?
Well, I think that's really, that's what the root of resilience is all about. I think because of so many of the high risk complications that we have, anxiety is inherent. And I mentioned this in the presentation that I think that is one of the most difficult things about living with a connective tissue disorder is this chronic awareness that something catastrophic could happen to yourself, to your family, to your children at any given moment. And carrying that with you all day long is exhausting, and it's a profound burden. So I'm glad this was a question, because I do think that that's a fundamental component of what our treatment needs to include. For many people, they will find that getting professional support with that can be incredibly helpful. There are a lot of therapists that specialize in chronic health conditions, medical traumas. All of that kind of background knowledge is a really helpful place to start if you're going to be meeting with a therapist. But you can also do a lot of this work independently and within your own social support network as well. It really comes down to acknowledging that that anxiety is valid. You know, a lot of the CBT work that I talked about is based on challenging distortions in your thinking. And with connective tissue disorders, it's rarely the case that our fears are distorted. And so it takes a little different strategy to say, these are very valid fears, these are very real fears, and yet I don't want them to dominate my perspective. And that's kind of what I was getting at in the cognitive portion of my presentation, that we want to try to be deliberate about what we are feeding. If we're feeding the anxious thoughts, if we're giving those all of our attention, if we're giving them all of the airtime in our brain, they're going to develop a life of their own and become even bigger than they automatically are. If we're able to put a lid on them to some extent, not pretend they're not there and not try to talk ourselves out of them, because that's never going to be successful, but put a lid on them and say, those are real. And also, I'm having a good day. My kids are here. My work is strong. My family loves me. I'm a little stronger today than I was yesterday. I survived this major medical event. Whatever is going on in your life, if you're able to shift the focus away from the fear and towards what is good, that's going to go a long way to keeping the anxiety at least moderated. But I do think it's something that is as serious a part of this condition as all of the physical manifestations.
Thank you. That was perfect. Another question: how to build a self-support network of friends, organizations, and similar that elevates self-esteem and a sense of empowerment?
All of those things. So I wish I had the question in front of me. When you're looking at your friend and family group, being aware of who are the people that understand what's happening, who are the people that step up and want to understand what's happening. Again, that's one of the things that I think is difficult with people with connective tissue disorders, is it's very, very difficult to understand what it is like to live with that. It's such an incomprehensible thing that when you can find those people in your life that get it, nurturing those relationships and really thanking them and letting them know how much you appreciate that they are seeing you and seeing your experience. Also, we're reaching out to the community. There, within the VEDS community, there's a very active Facebook group. The Marfan Foundation has been wonderful at including us, the EDS Society as well. but finding other folks that have these conditions, have family members with these conditions that can just get it is very, very helpful. I know the first time that I met somebody with VEDS, there was just this moment of, okay, I know you. We've never met before, but I get this. Like, we've had the same kinds of life experiences, and so we're able to support each other in a different way than the people in our lives that maybe we've known forever, but just don't fully understand. And again, I cannot endorse getting some sort of professional help. And that doesn't have to necessarily be long-term psychotherapy, but having somebody on your team whose main focus is you and your emotional health. We get people on our teams to take care of our cardiac health. We get people on our teams to follow our GI health, our physical therapy. We get all of these specialists on our team, but I think too often we think about mental health as an auxiliary or a side component of these conditions, and I would argue that it's really prominent, and many of us, if not most of us, should be including that support into our whole treatment team.
Great. Thank you so much. We have a question. My daughter has a spontaneous case of Marfan. It's very challenging for me to understand what is actually going through her mind and her body, and how can I help her to build resilience?
Well, start by acknowledging that. That's that radical acceptance component. There are things about your daughter that you don't understand because you haven't been there. And by acknowledging that, and I give you a lot of credit for even just kind of calling that out right out the gate, by acknowledging that, that opens up the door to learn more about the condition, to talk to other people that have it, talk to other parents of children that have these conditions, to really learn about those unique experiences so that you can relate to her better. But children, they're naturally resilient. They don't need us to be perfect all of the time. They don't need us to have all of the answers. As a parent, so much of what you do is help them become the best version of themselves. So in your 5-year-old, really letting them know what you are seeing and inviting them to share any concerns or any struggles that they have, validating that, normalizing that, and working together to find some ways to overcome it.
Great. Since a lot of kids are doing school from home now, which means more time online and sitting, do you have any tips about keeping, well, we're not going to ask you about the eyes and the body, but how about the mental health? Any tips about keeping yourself mentally strong during this time?
Yes, I'm in favor of that. It's really hard right now. It's really, really hard. I've got, I mentioned I've got 2 littles, one of whom just started kindergarten online today. So he's literally never met anybody in his class. And that is, it's just a hard thing that's happening right now. So, you know, trying to be creative, finding ways to get that connection. I think one of the silver linings of COVID is that we've all been forced to learn how to teleconference and video conference more than we had before. So we're a little bit more skilled in that area, even those of us that are technologically challenged. So finding those opportunities to connect with other people, whether it's your people who you're not seeing because of COVID, or connecting with people in the greater community, across the country, across the world, who are in a similar position that can relate to you in a different way. So nurturing, finding opportunities to make those connections within whatever restrictions that you've got going on in your community. Right here in Minnesota, we are doing a pretty decent job of COVID, at least comparatively, and it's kind of summertime for like another month before the snow starts to fly. So taking advantage of that opportunity that occasionally we can see other people outside with social distancing, and being able to say, okay, so we have this opportunity now, let's try to capitalize it in whatever way feels safe and appropriate, but being planful and mindful about building those opportunities in whenever you can. And it's about being flexible. You take walks around the block instead of going to the gym. You do some jumping jacks or have a dance party in your living room instead of going to baseball practice. But acknowledging that those things are particularly challenging right now and looking for opportunities to augment them in whatever creative ways you can think of.
Terrific. A lot of people are asking, how do you find the right therapist? How do you find a therapist who knows about chronic conditions?
You ask a lot of questions, you talk to a lot of people, and you interview therapists. Please interview. And I could bore you with the research, I won't do that, but literally the number one factor about what makes mental health therapy effective is the human-to-human relationship between you and that provider. So an analogy is you can have the best teacher in the world, but if your kid doesn't connect to the teacher, it doesn't matter that they're a world-class teacher, they're not gonna learn. And therapy is exactly the same way. It's, yes, you want a therapist that's skilled, you want a therapist that knows certain things, and I can go into that in a second. But more important than any of that is that you feel comfortable sitting in the room with that person or sitting across the computer screen from that person, and you feel heard, you feel seen, you feel comfortable, and that you feel like you can eventually relax and become yourself. It's always going to be awkward the first couple times that you meet somebody because it's just an awkward thing. But if you meet a couple people, 2-3 people, you're going to get a feel for who feels right for you. It's kind of like trying on a pair of shoes. You get the right pair of shoes, you just kind of know, and you might know some things going into it, and you can narrow your field based on what you know you like or you know you want, but you've really got to try them on before you know. So please, please interview therapists. If a therapist is offended that you want to talk to somebody else, then that's a bad therapist for you. No therapist should be taking it personally that you want to meet with a couple people and figure out who jives the best. In terms of practical skill sets, I really recommend looking for somebody that is familiar with chronic health conditions. That is a subspecialty of mental health providers. It's not always something that's clearly identified, so it takes a little more investigation or a little more legwork to look into. Starting with, if you have like a medical system in your area, that's a good place to start. Most of the big medical systems have a behavioral health department. And if you push a little bit, get past the front desk scheduler and get to like the behavioral health manager and explain, I'm looking for a therapist that has this particular skill set. I'd really like to work with somebody that's familiar with chronic health conditions, that sees that as a specialty and really knows how to deal with it. And the manager of that department, who knows all of the providers, they're going to be able to help funnel you to the people that are more competent or more comfortable with that. There's also a subspecialty of people who are trained in trauma work and or medical trauma, which is something that so many people with connective tissue disorders experience. If you can find somebody that has familiarity with medical trauma, it's just going to give you a starting point. Any therapist should be able to learn about your condition. Chances are you're not going to find a therapist that knows a great deal about Marfan's or VEDS or loey-dietz or what have you, but a good therapist is going to be able to take what they know about mental health, take what they know about people, take what they know about chronic health conditions in general, and have a much better understanding of what you're going through than somebody who's not already knowledgeable about chronic conditions or medical trauma. So those would be the two main things that I would encourage people to look for as skill sets beyond find the person that feels like the right fit.
Thank you. Excellent advice. I totally agree with the interviewing concept. Too many people don't do that, and that's very important. Another question. My 12-year-old daughter is very anxious and angry about her condition. She doesn't want to talk about it, and she says that talking about it makes her even more anxious. Any recommendations?
I would start by saying, yes, being angry and anxious about these conditions is the psychologically healthy response. As parents, we don't want our kids to feel angry and anxious, and so we have this urge to soothe them and fix that and make it better. And again, as a parent of 2 kids, I completely understand that. I don't want my kids to feel that way ever if I can avoid it. But that is a healthy response to such a difficult situation to be in. And so first and foremost, just giving her space to say, this is really hard, and being angry and being worried, that's normal and that's understandable. And then just giving her space, you know, opportunities to talk about it, encouraging her to talk about it when it feels right, giving her different places to explore and connect. Sometimes it's not mom or dad that kids want to talk to. Sometimes it's a friend. Sometimes it's somebody else that has the condition. Sometimes it's a professional. It doesn't, there are advantages to talking to a professional, sure, but it really doesn't matter where your child is getting support, because they're going to get all kinds of support from you. That particular support doesn't necessarily have to come from you if that person feels more comfortable talking with friends or talking with other people within the community. So I would say create space, let her process it as she needs to, and create an invitation to talk about it and explore it without making it a mandate.
Great. Would you recommend yoga as an overall way to build resilience for mind, body, and spirit?
Absolutely. As long as your medical team has cleared that kind of movement, the kind of twisting, bending, stretching movements, as long as that's safe for you, yoga is phenomenal because it's going to hit all of those main categories. It's going to give you some strength. It's going to give you the stretching and the stability, depending on the kind of yoga or how strong your fitness level is to begin with. Your heart's going to get pumping a little bit on those motions. Yoga also builds in that mind-body awareness, and that mental calm is one of the skills and one of the activities that you are actively practicing while doing yoga. So I think yoga is one of the best things that anybody can do, if not everybody with connective tissue disorders, because it gets at the physical and the mental simultaneously.
Great. That's one of the questions I'm going to actually kind of answer. Somebody asked if there's online support groups with scheduled real-time interaction. And I want to say, yes, absolutely. We have many support groups. You can look on the Marfan Foundation website, and you can also look on the VEDS Movement website. And both of them list a number of support groups that are offered on different topics. And if you have some ideas of support groups you would like to see that we don't offer, please contact me through the foundation or through the marfan.org/E3ask, and I will be happy to start new support groups. If anybody has any other questions, I didn't see anything else in here. Then let me put up my slide. Just some final thoughts. If you have other questions and they weren't answered, please submit them to marfan.org/E3ask. If you want them specifically to go to me, Susan Leshin, I am the social worker for the foundation. I will be happy to answer your questions. There is a survey in the app, and we would love for you to fill that out. Your opinion is so, so valuable to us. So please do that as soon as you can. Finally, we hope that you continue to take advantage of the number of sessions that we have during the summit. The summit will last until September 12th. There are many, many wonderful sessions, and I hope that you can see as many of them as you can live. And if not, you will have the opportunity to get links to them through our YouTube channel. If you would like to share your experience tonight or at any other program, please do so on our social media, and you can use our hashtag, which is hashtag E3Summit20. And we'd love to see some responses from you on that, and to encourage other people who have not yet even signed up, who maybe still will sign up for this. I really want to thank Karen Mountain Johnson so much for tonight, for being here, for being such a wonderful speaker and such a wonderful friend. And thank you for your time and your expertise. To everybody else tonight who's been watching and joined us, thank you for being with us. I hope to see you on another webinar or sometime in the future at conference or any place else. So have a wonderful evening, and speak to you soon. Take care.